Our next speaker is Dr. Vincent Agyapong. He's a clinical professor and inaugural director of the Division of Community Psychiatry in the Department of Psychiatry, University of Alberta. The work that he's going to describe today, at least part of it, is called Text for Health, Cognitive Behavioral Therapy Delivered to People in the Form of Supportive Text Messages. And he has evidence that that works. Dr. Agyapong.
Dr. Agyapong, you're still muted.
Sorry about that. Thank you very much. It's a very great opportunity to meet, and I want to thank the organizers and the attendees, as well as all the other speakers, for taking the time to be here to share knowledge about the various research projects happening among faculty from different Alberta institutions. Next slide, please. So I do have no conflict of interest, as was indicated. My presentation is mostly focused on some supportive text message work that we've done to help people with the pandemic address issues with stress, anxiety, and depression. Next slide, please. So as we are all aware, the COVID pandemic was declared a pandemic by the Director General of the WHO sometime in March of 2020. And since then, it's kind of taken a hold on almost every country in every corner of the world and having significant mental health effects. Next slide, please. We know there have been closure of businesses and there have been so much disruption to the life of individuals across the globe. Next slide, please. In particular, schools were shut down in various countries, many people moving to online, and the hopes and aspirations of many of our young children in schools were dashed. Those that were hoping to take up summer jobs and those that were hoping to graduate in June of last year and expecting to pick up jobs had their hopes dashed. Next slide, please. We're all aware that hospitals across the world quickly became overwhelmed with patients. Next slide, please. So this an item from the US. Next slide, please. And this was no different from Alberta. Alberta, obviously, we've seen over time that the numbers of patients being admitted and unfortunately those dying from the pandemic have increased as well. Next slide, please. As a result of all the measures instituted to address the COVID, in particular the lockdown, there's a lot of people who have lost their traditional connections to members of the community, and therefore loneliness has become the norm for many people in Alberta and across the world. And there's been a significant correlation between loneliness and the increase in mental health issues during the pandemic. Next slide, please. In Japan, for example, it was reported that in October alone, the number of people who died by suicide was far greater than the number of people who died by COVID infection throughout the entire year of 2020. Next slide, please. There's also a study that projects an increase in suicide rates in Canada as well. So, I mean, clearly the mental health effects of the pandemic have been very devastating. Next slide, please. So very much in anticipation of the increase in mental health problems that Albertans will be experiencing as a result of the pandemic and associated measures, we relied on our history of people benefiting from a previous program called Text for Hope during the Fort McMurray wildfires, and we approached various stakeholders. About 6 health foundations came together to fund a program called the Text for Hope program. Next slide, please. So this is just a slide that shows some of the publications that speaks to the prior evidence of the intervention which was the basis upon which we thought we can be able to support people during the pandemic. Next slide, please. So this is a protocol that was actually published that set out really what we aim to do right from the very beginning and what we're going to measure in terms of how we're going to see if whether changes in stress, anxiety, and depression levels in those who subscribe to the program was improving. Next slide, please. So Text for Hope is a program that all Albertans can be able to subscribe simply by texting the word COVID-19 Hope to 39 39 39. As at this day, we have had over 52,000 Albertans enrolled on the program since it was launched in March of 2020. The messages have been written by psychologists and other patients and are targeted specifically at alleviating symptoms of anxiety, depression, and stress. Next slide, please. So this presentation is focusing largely on some of the early outcome measures that we've been seeing with the intervention. Next slide, please. So this is a paper that was published in JMIR Mental Health, and it reports mainly the findings from the 6-week evaluation. So anybody who subscribed to the Tech for Hope intervention receives a link to an online survey which measures basically stress, anxiety, and depression using validated instruments. They are also required to enter their cell phone numbers as their ID. And at 6 weeks, we send them another link to a survey which they complete. And therefore, because they use their cell phone numbers with which they receive the messages as an ID, we're able to track the progress that each of the subscribers are making. We do not report individual results. We only report aggregate results. And therefore, confidentiality is not something that subscribers need to worry about. So if you can see from the tables here, we actually saw significant reductions in both the stress and the anxiety levels in terms of the mean scores at 6 weeks. And also we looked at the prevalence rate for clinically meaningful stress and anxiety. And there was also a significant reduction in those. But at 6 weeks, we did not see a significant reduction in either the mean score for depression or the prevalence rate for clinically meaningful depression. Next slide, please. We also sent all subscribers another survey at 3 months, which also helped us to be able to track their progress. So this is a paper that reports on that. It's been accepted for publication with with disaster medicine and public health preparedness, and should be published in the next few weeks. But again, if you look at the mean scores for stress, anxiety, and depression, there was a statistically significant reduction in all 3 measures of evaluation. And similarly, if you look at the clinically meaningful, the prevalence rate for clinically meaningful stress, anxiety, and depression, there was also a statistically significant reduction in these as well. We found the biggest reduction in actually the anxiety measures. So for example, in terms of prevalence rate, there was about a 15% drop in the anxiety measures. And if you look at also the mean scores for the GAD, there was about a 22% reduction in symptoms of anxiety as a result of people receiving the supportive text message intervention over a 6-week period. Next slide, please. We wanted to see if really the intervention was what was contributing to the reduction in symptoms that individuals were experiencing, or probably it was just because of some environmental factors, or maybe because of their demographic and clinical characteristics having a role to play. So we took 2 time points. At one time point, a time point where people had completed receiving the messages for 6 weeks, and then other people were enrolling during the same time period. So it was a 6-week period where we had 2 groups of people. We took the 6-week survey results and compared it to the baseline survey results of the people that were enrolling within the 6 weeks, which means that we were controlling for the environmental factors because all the two groups were being exposed to the same environmental conditions. And then we controlled for their demographic and clinical, for their demographic variables as well. Next slide, please. So in terms of the differences that we saw, when we look at the mean score and we compare the intervention to the control group, we found out that there was a statistically significant difference between those who had received the text messages for 6 weeks compared to those in the control group. For example, if you look at the generalized anxiety score, it was 9.6 for those in the control group compared to only 7.55 for those in the intervention group. We aggregated all the scores for the 3 scales that we call the cumulative mental health score. And if you look at that, it also signifies that there was a significant reduction for those who were in the intervention group compared to those who were in the control group. Next slide, please. We look at 2 other interesting measures. So we looked at the prevalence rate for clinically meaningful anxiety, stress, and depression. And we did find that those in the intervention group, that's those who had received the text messages, had significantly lower prevalence rates for both anxiety, stress, and depression compared to those who were in the control group and were yet to receive their messages. We also look at 2 items on the PHQ-9 scale that we use for depression. Basically, one was looking at suicidal ideation, those who had experienced suicidal ideation, and those who had also experienced disturbed sleep. And if you compare the intervention group to the control group, there was about a prevalence rate of about 26.6% likelihood to experience suicidal ideation compared to only 16.9%, which means that the intervention was really able to knock off about a 10 percentage point difference in terms of those who are experiencing suicidal ideation. Similarly, if you look at disturbed sleep, it was 85% in the control group compared to 76.9% in the intervention group as well, which means the intervention was able to significantly help people improve their sleep as well. Next slide, please. We looked at also the satisfaction of subscribers with the intervention, the Tech for Hope program. And if you look at this, there were about 48% reported that the daily messages helped them to cope with loneliness. About 53% said it helps them to cope with their depression. Coping with anxiety was 74%, and coping with stress was also about 75%. Next slide, please. In terms of enhancing quality of life, about 58.3%, improving mental well-being, 73%, managing COVID-related issues, 72%, and also feeling connected to a support system was as much as 80.6%. Next slide, please. So on foot of the success of the launch of the Tech for Hope program, we also recognized that there were 2 groups of patients who had lost their traditional supports as a result of the COVID pandemic. Those who were dealing with addiction issues and those who were dealing with cancer and had some of their cancer treatment programs interrupted. So we launched 2 additional programs, the Open to Change as well as the Cancer Care program. And subscribers can simply text Open to Change to subscribe to the addiction program. And also, if they want to subscribe to the Cancer Care program, can text Cancer Care all together to the same designated number as well. Next slide, please. So in terms of policy implications, this is a program that's been recognized by the World Health Organization. It's cost effective. It costs only about $10 to send subscribers daily messages for about 6 months, and it's not a cost that the subscriber pays. It's a cost to the health founders who are funding the program, compared to like a program like CBT, which will cost about $1,800 for 12 sessions. In terms of equity and digital divide, we know that about over 90% of Albertans do have, text message enabled phones, and people are generally very able to use text messaging programs. Next slide, please. The slide before that. Yeah, there's no wait list. So everybody who subscribes begin to receive it immediately. There are no geographical barriers to access. You can be in any corner of Alberta and receive your daily treatment. And we believe that it will help to reduce the need for face-to-face counseling. Because if you have 50,000 people and you are even able to help even 20% of them, you definitely reduce the number of people who require face-to-face counseling. Next slide, please. So these are the health foundations who have supported the program alongside Alberta Health Services, and it's just appropriate we acknowledge them. Next slide, please. So I want to thank the many organizations in Dublin, Ireland, where I initially did the first trial, to Fort McMurray and Grand Prairie, where we conducted the second and third clinical trials, to the Edmonton zone, where we learned the Text for Support program, and subsequently we've learned the Text for Mood, the Text for Hope program. Next slide, please. Thank you very much.
Thank you, Dr. Agyapong. I have a couple of questions. It's intriguing to me that text messages, which in some ways are the least personal of other, electronic communications, whether cell phone or, Zoom or whatever. Can you run through, if I register, what happens? Do I get a text right away? How many texts do I get?
Yeah, so the moment you register, you text COVID-19 Hope to 393939, you immediately receive a welcome message, which tells you about the program and what to expect. It also tells you, if you want to unsubscribe, what you need to do. And basically also send you a link to the baseline evaluation survey, which allows us to be able to see how you are doing before you begin to receive the daily messages. So the next day after subscribing, you receive a text message a day at 9 a.m. every day, which basically have been crafted by cognitive behavioral therapists in conjunction with patients, as I said, to address symptoms of stress, anxiety, and depression. The messages are the same kind of messages that you get in a session with a mental therapist, which have been chopped into bits and pieces and delivered on a daily basis in small doses. So they do the same thing as CBT, only that you don't need to go and park a car to a therapist's office or take time off your work to go and receive your treatment.
Right, and if I had registered a month ago and then somebody registered today, I'd be getting different messages than they are?
Yes, so we program the messages into day 1 up to day 90, which means if you register today or you register in 2 weeks' time, you get the message for day 1 on the day that you register. So they've been arranged in the same sequence so as to benefit the patient. Similar to if you go to see your therapist 12 times, the therapists know what they have to do on day 1 and what they have to do on day 12. So we've arranged the messages in a similar fashion so that there's an incremental benefit as people continue to receive the messages.
Now, you may not have data on this yet, but as we all know, and I'll confine my thoughts to Alberta, but it's true everywhere, there was a first wave and people would have reacted to that because there was social isolation connected to that. But then numbers got better. And then there was an even larger, in many places, second wave. Have you seen any, you may not have had time to gather this data, but would you anticipate changes in responses or changes in numbers of people signing up that track the course of the pandemic?
Well, we do have the data, and definitely that's one of the things we need to do, is analyze it on the basis of comparing the infection rate with even the symptoms that people are reporting in terms of their baseline. We do have that data. We've not done that analysis there's a renewed effort to re-advertise the program, which I think will be very helpful in increasing the subscription rate over time, because there was a very big bang, because there was an initial kind of huge announcement from the government of Alberta, which led to many people hearing about it. But subsequently, those who even visit our clinics have not heard of the program, which suggests there are so many people who are struggling, who are not even aware that there's a tool like that there that'll be very helpful for them. So there's a renewed effort in the next few weeks to increase the advertisement around this, to increase the numbers, which will be very helpful.
Yeah, the results are very impressive. Thank you very much.
Thank you.